Kelechi, and yes.
I was expecting Andrea first.
Would you like to go through Andrea's slides as far as you can?
She has joined.
Right, Andrea has joined. Yeah.
So Andrea, are you able to? Andrea? I think you're going to have to assume she's not there then.
Right. Okay. Should I do hers then?
Yeah, I think so.
Hello, everyone. In Andrea's absence, I will share the information she was meant to present to everybody. I'm pleased to welcome you to the Spring to Equalities, Working Carers and a Wider Diversity Agenda webinar. I'm really delighted that this has come to pass today because it's something Andrea and I talked about in February, and to see that it's happening today is fantastic. Andrea is the head of operations of Equality Northeast, and we met up in February to discuss working carers as part of a wider equality and diversity agenda. And from that discussion, we decided we'll do this webinar as a joint initiative because we are a carer organization that supports unpaid family carers in the UK, in Gateshead. And Andrea's organization is also based in Gateshead. There's a little bit of information there about her organization and all the work they do in removing barriers in employment, working closely with employers. They've also recently a wholly owned subsidiary of Gateshead College. I think that was in 2012. So there's a lot that Equality Northeast does for employers, and also does with the college in relation to supporting students in achieving their highest potential, especially people with disabilities in colleges. They also have Equality Standard Awards that they present to organizations who are fit to receive it and who have to meet certain criteria to, be awarded these standards. If Andrea were here, she'll probably be able to talk through these awards with you. Or if you want to know anything about the awards, please do get in touch with her. These are some of the pictures from previous awards to befitting organizations all around the Northeast. These are some of the information she's put forward about Equality Northeast, the kind of organizations they support, and all the work they do through virtual working and face-to-face work. And they also have an extensive knowledge bank, which I used to access when I worked for the council. We had a lot of work to do with Equality Northeast. So moving forward, Andrea was going to talk about how this session will work. And one of the things she was going to mention is the stages of the webinar, and also my role and her role, which I'm more or less playing this morning. She will also have mentioned the carer-friendly employer charter that Gateshead Association presents to employers, which, if you are interested in pursuing, to talk to me outside of this program. There are also many festivals that Equality Northeast arrange or are involved in. These are some of them. Andrea would have been able to talk about them, but I won't go into them because I haven't really got much information around them. And I'll be taking you through the rest of the webinar. I'm the GP liaison of Carer Training and GP liaison officer. based at Gateshead Carers Association. My role involves developing and delivering carer awareness training for employers and everybody who works with carers. I also work with the 31 GP practices in Gateshead, delivering carer awareness sessions, and also developing carer training for unpaid family carers in Gateshead. So today, we're going to look at the 4 stages of this webinar. The first part of it is going to look at why we are here, which is obviously the aims and objectives. Having gone through the registration form you've all provided, I've tried as much as possible to cover key expectations through this webinar. However, there might be issues that the 90 minutes of the webinar might not provide answers to, which I'll be happy to maybe discuss with you via email or other means. I'll be happy to take any pressing questions as we go along, but we must keep this to the minimum in order to cover what we've got today. Next, we'll be looking at the overview and key issues about caring. And that's important if you are to make the best use of the session. And the next part will be the workplace and carers. Then again, I'm expecting that people would hope that at the end of today, they'll be able to go out and do something to change their workplace if they've, through this session, realize that it's not as carer positive as it should be. That's what we could explore in the 4th part of this program. So the aim of this session, is to ensure that as an employer and a business owner or an HR manager, whatever your role is in relation to working with carers, that individuals on this session today will gain better understanding about carers' needs, because the needs that drive carers are the specific needs that cause the situation which prevents them from giving up work. And these needs can be jeopardized if we all have assumptions which prevent carers from accessing the support available. And often a lot of the support isn't something that is paid for. It's just the lack of knowledge about the support that hamper their employability, identification and support, progress and retention at work. We'll be looking at that very closely through this session. I've got a few objectives here, but I would like you to focus on the bold prints, who a carer is, the stages and impacts of caring. As I'm aware that not everybody on this course, on this webinar today, would have maybe had a carer awareness session. So it's really a dual purpose of kind of bringing people up to speed with what carer awareness is, and how that can, having a carer awareness can influence the work that managers and employers do and the support provided for carers in the workplace. So I've got 9 key objectives, and I do hope those objectives represent what you hope to get out of today. So moving on, carer statistics. I couldn't do this session without a snippet of this. In the 2001 census, there were 5.8 million UK carers, and by the next 10 years, this had gone up to 6.5 million. And it is predicted that by 2037, there will probably be 9 million carers in the UK. And £119 billion represents the value of care that unpaid carers provide by saving the NHS and social care money. Currently, the NHS, well, last year the NHS was funded at 11.16 billion. So if carers are providing 119 billion in unpaid and free care, if you add that to the NHS budget, the NHS will probably collapse. So the carers keep the NHS and adult social care alive. And the disability aspect there is that 61% of carers are disabled. They have a disability in addition to having a caring role. 52% only are the number of carers who don't have a disability. So in addition to caring for somebody, a lot of carers also have disabilities, which is something we need to pay attention to as employers or business owners or HR advisors. In relation to gender, we've got 58% female and 42%, as you can see there. The women are more in number. So it means if your workforce is a female-dominated workforce, you're likely to have more carers there. But having said that, we'll look at the issues around male carers and identification in the workplace as well. That might also throw some light on some of the issues about male carers that you might not be aware of. 1 in 5 carers are aged between 50 to 64. And believe it or not, this has a huge implication on people in your workplace, because the peak age of caring is 50 to 64. So if carers within this age group are not supported, they are likely to be people in your workforce who have the greatest experience, skills, and also who probably have stayed there long enough and know all the history about the organization. And finally, a lot of carers lose up to £20,000 in finances when they give up work. 42% miss out on benefits that they should be entitled to as a result of giving up work. So there is a huge implication there in terms of statistics. So whose face fits the role? How do we know? Do we know by looking at a person at work whether they are a carer?
Kelechi, I'm sorry to interrupt, but is this something that you would like colleagues to have a go at answering before we move on?
Yes, that would be good.
Please do unmute your microphones and do tell us how we can recognise a carer. That's the question.
Yeah, whose face fits the role?
Yes.
Any ideas? Do you know, if looking at somebody, would you know at work? Well, it's difficult to answer.
Vicky, go ahead and unmute your microphone.
All of them.
All of them.
Yeah.
I understand what you're saying about the 50 to 60 age bracket, but I work with children and young people who are carers as well. And it's devastating actually to see how the strain on, say, adolescents when they've got a parent who has been in an abusive relationship and the child has to take care of the parent who is too ill to take care of the child, who has to go to school and get the grades and so on and so forth. And it's heartbreaking.
Yeah, I totally agree with you. There is an increase in the number of children who are young carers, but when you're looking at working carers in the workplace, children are not likely to be there, which is why I'm focusing on the adults, but it is a point you've made there. But we'll see the implication as well in referring the working carers at a subsequent part of this this session. Then that's where the young carer issue comes in. Thank you very much, Vicky.
We also have a Ruth Thompson in
young carers. And you want to do the chat one first, Yaya?
Yes, I was just going to say that Ruth Thomas has commented that it's the face that looks the most exhausted. I think
very true. Very true indeed. Yeah.
Well, well, that could be misleading, but I think when we go through this session and look at the assumptions, you'll be amazed what people's faces cover. So the answer really is it easy to tell? Not really. Could be anyone in your workforce, anyone close to you, or even you. sometimes it's difficult to identify oneself as a carer. So, who's a carer? Anybody wants to have a go at who a carer is? Just one sentence, or you don't have to give me a lengthy definition.
Andrea's got a raised hand. Come in, Andrea.
Yeah.
Andrea has just
unmute Andrea on the phone, and she's 7540418008.
Yes, thank you. Andrea Walker has just said that anyone who looks after another person.
Yes, that's the definition I would expect. But there is a lot more to that looking after. I'll share the definition we use for carer, and it is what you see there. Someone of any age, gender, sexual orientation, background, who provides unpaid support to a relative or friend who couldn't manage without this help. So the key word there is unpaid. They've got to be unpaid. People might wonder, well, if they are working, they are paid. Oh, they might be in receipt of carers allowance. But we shall see to that when we start looking at the assumptions that people make about carers. And I've included that phrase on the side, parents are included, because a lot of parents with young children who have no disability often think that they are carers, but there has to be disability and chronic illness there for a parent to qualify as a carer. So moving forward, one of the things I said earlier when we were looking at the statistics was around the health and well-being of carers, how many carers have disability. And I'm going to share with you some data from a research carried out by Carers UK in 2010. I'm sure this would have been taken over by more recent research. But that struck me when I saw the numbers of the percentages of the from carers' health and well-being. These are all the things that were reported. These are not really surprising when I look at the carers who come in here to access support from our organization and their well-being situation. So the next thing we are going to look at is the 9 assumptions about carers. I'm going to show you each assumption, and in addition to the assumption, I'm going to be looking at reading out to you some scenarios that support those assumptions. So hopefully, by the time I read through these scenarios, you'll be able to have a peek into what goes on in a carer's mind, and hopefully you'll be able to address some of the issues that we've talked about around definitions and other things. Sorry, my clipboard is falling down there. I apologize for the noise. Okay, so the first assumption we have there is from this lady who's fictitious, and it's very common in the workplace to think that anybody who's a carer is going to tell you they have a caring role. I am Kemi. I dislike the title carer because it detracts from my identity as spouse, mother, daughter, or sister. Sometimes it confuses me because I don't know whether people are referring to my son's paid carer who comes in the evening when I'm at work. More so, my African culture doesn't even have a word for carer. You're either a wife, daughter, daughter-in-law, or sister. This makes it really difficult for me to identify myself as a carer, talk less of accepting the support I get offered for people in such roles. Okay. The second assumption is that they are willing to care and able to cope. Well, people often think someone taking on a caring role must be doing that because they think they can manage. Well, let's see what the case is. This guy says, I'm Roderick, and my wife, Becky, tells everyone who knows us that everything is fine and that we are managing okay with Enzo's needs and care. I wish I could have some time on my own to talk to someone or just tell them how it really is. My views have never been established by anyone. People at work aren't even clear about who the main carer is. She's the one that they see picking me up from work with Enzo in the back of the car. And so all they assume is that she's the main carer. But I do most of the tasks involved in caring for Enzo from dawn to dusk. By the time I get to work, I'm very exhausted. All she does is drop him off at school and pick him up on her way from work, then pick me up from work. I don't sleep well. I don't have a social life. I could go on. She doesn't even talk about the effects of all of this on our daughter, who equally needs our love and care and support. She's a young carer and can't really be coping with all of this. Becky is the higher earner and seems to manage well with all the bills. But how about the psychological and physical impacts on the wider family? Who bears the brunt of it? Me. I'm tired of ignoring and suppressing my own health, emotional and psychological needs. Can someone please help me before I lose it? That's Roderick. The next person I've got is Zainab. And the assumption she's going to bring to light is that carers from Black, Asian, and minority ethnic communities will not require services because of extended family. Could be an assumption some of us have about people from these communities who work for us. Zainab says, all the neighbors call me Smiley Zainab. I only wish they knew what went on behind the smiley face of mine. Many moms who have a child with special needs in my community often can't work and look after the child at the same time. Caring is down to moms as tradition dictates. Even when you have a house full of people, the expectation is that everything about our son, Saeed, is my responsibility, in addition to my part-time job as a cleaner at the local school. My husband is a taxi driver and traditionally the main breadwinner. He expects that I should be able to cope with the challenges of caring, looking after his elderly parents who live with us, doing the laundry, cooking, cleaning, and washing, and having meals ready for them and the children coming home each day. After all, that's what a good wife does, isn't it? In addition to other members of the family, I can't speak very good English because I lost my place at the English classes since nobody was prepared to relieve me from my daily responsibilities and to enable me attend in the evenings. My employer doesn't care whether or not I get a break from caring or know how and where I could get accessible advice and support. Despite all of this, I still need to work. Otherwise, I'll have no spending money of my own or an outlet to communicate with other people. So that's Zainab's story. The fourth assumption there is they always have notice of meetings regarding they are cared for. A number of times people come to us to complain about how, people are fed up of them springing up last-minute appointment surprise. So let's see what Chan Ying has to say. I am Chan Ying and wish someone could believe me at work when I say that I have only found out about Mom's appointment. Her hospital and GP appointment letters get sent to her home address. And most times she doesn't tell me until the day before she's due an appointment. That's when if she remembers. Sometimes she doesn't open the letters on receiving them until I find them unopened, mostly between pages of books or magazines she had been reading. She has a confidentiality contract with the doctor, which means that I can't be told everything that's going on with her. I'm there to take her to appointments and don't go into the consulting room with her, even when I'm her main carer. Things might work out better if I were consulted from the onset before she makes her appointment, or at least inform me as soon as the letter arrives. My work situation is complicated and she doesn't understand that she makes me look like a liar each time I tell my manager that I found out about her appointment late. My teammates are beginning to get fed up with my unplanned absences for mom's appointments. How on earth can I explain all of this to them? The next assumption there is by Jason. I am Jason, and I'll try my level best to look after Clive as long as possible. I want to keep my hopes high that he wins his fight against colon cancer. There is no need for anyone to know that the partner I love so much, look after, and have lived with for 9 years is also a man. I'm proud of who I am. My manager and other members of the team don't have to know that I'm gay. I am a carer, but nobody needs to know who I look after if it would out me. Jason's story is actually from a first-hand experience, and I've anonymized, I've used fictitious names here. This individual actually resigned from his job when his partner became terminally ill and was dying, instead of telling his manager. And the sixth assumption here is staff who are carers should be able to express their concerns and needs to management. Well, let's see why they might not. I'm Diane. I've come a long way professionally. I at least expect that I will be the deputy head at this stage in my career, which I am. We need all the money that I can earn, especially now that Dave is not well and wouldn't get better from the look of things. I cannot afford to admit that I'm getting to a point where I'm really struggling with looking after Dave and keeping down my job as deputy head at the same time. I just have to keep this continuous smile on my face, no matter what my circumstances are. It's working well at giving everyone at school the impression that I'm juggling my two roles really well. I need all the strength I can muster. That's Diane, obviously terrified of her caring role impacting on her career progress and responsibility. And the next one is that staff who are carers seem to have a short fuse and often appear difficult and impatient for no reason. I am Ian. Whilst I try to meet everyone's expectation in this office, I don't think colleagues really understand how the pressure of being a working carer affects me. I can't stay late to catch up on admin, as I've got to go home for school transport, dropping Kimberly off. Kimberly's his daughter, obviously. To my colleagues, being held in the traffic is not enough excuse for being late. I try my best to meet deadlines despite everything else going on in my life. If I slip a deadline, I notice the reaction from other colleagues and the sarcastic comments. I wish you could all walk in my shoes, be a single dad with a disabled child for one day. Perhaps you might get to know why my fuse is sometimes short. I'm often late and appear tired of explaining myself, even when I'm clearly wrong. The next assumption here is about employees who are carers having the relevant knowledge and skills for their caring role. I am Queenie, one of the cooks at the council's canteen. My son, Paul, has just been diagnosed as autistic. He was diagnosed 7 years ago. I don't know much about the condition. I need some more training as he approaches puberty and becoming more challenging to deal with. All the courses available are delivered when I'm at work. I can't find late afternoon or evening sessions anywhere. I should have been attending the parenting program for parents of children with autism who are teenagers next Tuesday, as it's one of the many courses that I need. However, I'm not sure whether my manager would accommodate my numerous training needs, as he always reminds me that I work part-time and need to use the days I don't work more creatively. Unfortunately, most courses nearly always fall on those days that I work. I really do need these courses because of Paul's changing needs and behavior issues and my need to manage them in order to maintain my sanity. And the last but not the least assumption is about employees in a heavy caring role employees in a heavy caring role have a full-time job anyway. They shouldn't try to juggle paid work at the same time. And that's by Roger. I am Roger. Try living on carer's allowance for one day and see what life on benefits is like. Not with several competing needs and priorities staring at your face all at once. I need to work to keep sane. It also means I can take my mind off the caring role and get to meet with other people, even if it's only twice a week. I've tried not to work and nearly died of isolation and poverty at the time. I couldn't replace something as essential as our fridge, which packed in. Couldn't get a cheap vehicle insurance because I was unemployed. Could not even afford new tires for our car. It was awful. I couldn't live like that ever again. Working makes all the difference. And if it's only 4 hours, that will do me for a week. So if you are thinking that I need to give up work to focus on caring, try living on £62, 10 pence a week of carer allowance. So looking at all these assumptions, what do we reckon is the assumption top tip? Anybody?
Thank you. Colleagues, please either unmute your microphones to contribute or do so in a chat. Andrea?
Hi everyone. Top tip for me is to be open and honest with the employer about the circumstances. I'm a carer myself. I hold a full-time job and also look after my dad. I have a grown child with special educational needs as well. So just being open and honest from the very beginning if you can.
Thank you, Andrea. That's spot on. Anyone else?
Yes, I mean, my suggestions are coming from a mental health perspective. I think I commonly find that the point you raised earlier, that people sometimes don't realise that they are carers. So bringing some self-awareness to the situation and giving yourself permission to accept that you're not in a normal situation, you're in a really stressful situation. And bringing that self-awareness to the situation is important because quite often people are just in it and just don't know where to turn.
Right. Thank you very much, John. For employers, really, I think the key gist there is not to make assumptions unless you know the whole story. And from what Andrea said earlier, it's that communication that tells the whole story, being honest from the beginning and being open as an employer. The idea of telling all these assumption stories is to enable all of us here to hear from the horse's mouths. They are made up of stories we've heard over and over again from carers, which have been anonymized to protect people's identity and their employers as well. So next, we're going to look at the 4 stages of caring and the impact of caring. They are pretty straightforward. I try to create the slides in a way that it's easy to follow, even if you're not listening to what I'm saying. We have 4 key stages. The acute or crisis stages is when someone first lands the caring role due to its unexpected nature. It can be quite a trying time. And we've adapted this from loosely, really, from Dr. Elizabeth Kubler-Ross's grief cycle, which she outlined in her book, Death and Dying. Carers experience similar stages in their caring role. It's all the chaos, unanswered questions, why is it happening to me? And the next stage is the changing perspective. There's so much anger and resentment at this stage with people trying to access services and, being affected by red tapes and feeling powerless. And by the 3rd stage, I think carers often begin to accept that the caring role is there to stay. And this is often when we get to meet carers for the first time. It's difficult to put a timeline on when these stages are, but a majority of carers we come across, due to lack of information, don't get to the acceptance stage until after the first 5 years of caring. And that's when they start accessing support from carer agencies and maybe solving problems that have been ongoing for like 4 years before. And the last stage there is end of caring. I'm sharing this with you today because you have lots of carers in your workforce who will be at very different stages. And it's important that at these stages, we are signposting them to appropriate support. We also support carers after caring has ceased. So even if the caring has come to an end, there are issues that this 4th stage present for carers. It's exactly the same as losing a job. So moving on, the impact of caring. The areas shaded in purple and blue show all the impact from caring and the precipitating factors. The texts in the white box show the reasons behind the impact. If I just take one of the impacts, relationships, when you think of the workplace, employees who have become carers no longer come out for team socials. They are hurrying to finish work and go home and get on with it due to lack of time. It's not just relationships at work, relationships at home that have been derailed by their loss of identity, the distance they care from. And we have carers who travel back and forth every day, maybe 20, 24 miles or more to assist a parent, because we don't all live with our parents who need care. Lack of information brings isolation. So the sooner carers are referred or enabled to access information, the less isolated they will become. Because caring means that they lose their social network. Where there is language barrier or literacy problem, there is a big problem as well. We've looked at the statistics for health, which is scary, but looking closer at that without having any breaks from the caring role, sometimes it's difficult to fit in appointments. Sometimes lack of sleep and even not eating well because they can't afford to buy the right things to eat, or they are spending more time cooking for the cared for, could be an issue. So that takes us on to the reason why we are really here, carers in employment, why they are likely to give up work. There is still an assumption that becoming a working carer is basically a problem in some of the workplaces we support. Not just a problem for the organization, for the individual. This is the general, feeling that we get every day. But carers should be viewed as an opportunity to be more innovative with the opportunities we have in the workplace and some of the systems we have. The fact is that nowadays, people are living longer due to advances in medicine, nutrition, lifestyle, and it's evident in the way retirement age keeps getting pushed back. Who knows? By the time we get to that age, the retirement age might be near to 80.
Yeah. I'm sorry to interrupt, but it might be more appropriate to address a comment that we have in the chat now before you move on. And it's from Ruth saying that when you talked about the 4 stages, surely many people don't go through stage 1. The realization that they are a carer comes on gradually as their dependent becomes gradually more disabled or reliant on them. It's not always overnight.
Yes, that's absolutely correct. But sometimes caring also sets in through maybe a tragic incident. That means that someone's become disabled all of a sudden. We had the recent news on the TV yesterday about the young woman who got injured by a horse in Egypt, who can't walk. So I think what Ruth's saying is right, but we also have to factor in people who have that caring role from circumstances that are sudden and maybe tragic, like accidents. Does that help?
Well, I'm sure it does, but there's a kind of important to acknowledge that both
Yes.
is the case, and it does, on many people it creeps up without really that time.
Yeah.
There is another message. Just bear with me a moment. No, that's the only one.